Welcome everyone who was able to join us today. We're very pleased to have you here to discuss COVID-19 and its impact on food insecurity. My name is Sarah O'Connor. I'm with the MCW Office of Community Engagement. I want to just start off with a few logistics, and I also want to apologize for any challenges you had joining this meeting. Several of us were experiencing issues, and we're glad if you were able to get on. And sorry for these unexpected challenges. We're all adapting in this new virtual world. You can see the various reminders. I want to call out a cell phone number to text if you lose your Zoom connection. So if you want to make note of that while this slide is up. We will have plenary session speakers, and we are going to hold questions until the end. So please submit your questions via chat throughout both plenary sessions. They will be compiled, and then we'll hope to get to as many as possible in the Q&A. You should have either already completed a poll with your first and second choice for breakout rooms. If not, you can complete it at any point. And I think it's just come up, so please complete that. These are the result of the input you provided to us when you registered, so thank you. At this point, I would like to introduce Dr. Saeed Ahmed. He is the Senior Associate Dean for Community Engagement, a professor in the Department of Family and Community Medicine, and he is going to speak a little bit more about the context for today and introduce our plenary speakers. I am very pleased for him to speak, but I'm actually going to ask him to hold just for 1 sec because I forgot to very briefly review. The Office of Community Engagement researches the scholarship of community engagement, and therefore we use themes that come from discussions for possible future publications. We would never use direct identifiable information, and by attending, your consent is implied. I would like to offer that if you have any questions about this statement, please just chat at everyone and say, I have an IRB question, and someone from our staff will privately get back with you. So at this point, I would like to introduce Dr. Saeed Ahmed.
Thank you, Sarah. Thanks everyone for joining us. I am going to give you a very brief context of food insecurity. We know that food insecurity has been in the United States for decades, actually getting worse over time. With the wage disparity, socioeconomic inequalities, all factors in the food insecurity. The COVID-19 just compounded it in a very difficult way for all the people, but most with the communities of color. We have about more than 40 million people who lost their jobs because of COVID. Even before the COVID, vast majority of workforce live paycheck to paycheck. What it essentially means that people have trouble feeding themselves. Hunger impacts roughly about 1 in 10 US population. And with COVID, the number has doubled. And for the kids, it is 1 in 4. This is the situation in the most advanced, prosperous country in the world. And that is the national backdrop. Today, our dialogue would be connected to our local response. We'll talk about what we are facing here in Milwaukee, Wisconsin, what is being done, what are the proposed idea or action item we can take, learning from this crisis. So my job is to introduce, and I'm honored to do that, introducing all these speakers. The first plenary speaker is Raina Andrews. Her talk is titled Food Banking Amidst COVID. She is the Senior Director of Community Impact for Feeding America, Eastern Wisconsin. She serves as a public health ambassador, author, activist with her core work in food security. Raina is the founder of the Healthy Food Movement, a food literacy initiative focused on solving preventative health disparities for our next generation. Following Raina, we'll hear from Jenny Ovide and Reverend Dan Chaplaski. Their talk is titled Farm to Hospital and Community, COVID Challenges. Jenny is a registered nurse and currently serves as the Community Medicine Clinical Coordinator at the All Saints Family Health Center and has been at the health center for last 20 years. Her work combines creativity, health education, community engagement, and she has created programs for family medicine residents, medical students, patients, and community members. The clinic hosts a garden, a collaborative farm with Mount Calvary, where her work intertwines with Pastor Dan. Pastor Dan is the pastor at the Mount Calvary Lutheran Church in Milwaukee, and he has been at the Mount Calvary since 2013. He is a part of the Mount Calvary Community Development Corporation, a separate nonprofit corporation that Mount Calvary Lutheran Church established in 2016. Pastor Dan is involved in their signature program, Farm to Hospital and Community, that works in conjunction with Ascension St. Joseph Hospital and Ascension All Saints Family Health Center in Milwaukee. They operate an urban farm that provides fresh, naturally grown vegetables to at-risk communities. Thank to all our speakers for sharing their time, knowledge, thoughts with us today. At this time, I will turn it over to Raina. We cannot hear you, Raina. Yeah.
Hello, good afternoon. I was saying good afternoon, good morning, good evening, because I'm often not sure what time of day it is nowadays. Things have been really, really crazy. So I'll just share just a little bit about the work that we do. Can you move to the next slide? Move to the next slide. Thank you. So I'm the Senior Director of Community Impact at Feeding America Eastern Wisconsin. And for those of you who are familiar with Feeding America or not, we are the state's largest food bank geographically, making up the 35 counties of eastern Wisconsin. And if you look on this map, the black and red stars identify our food bank, where in Milwaukee on 17th and Fond du Lac is our headquarters, and we have another facility in Little Chute. And pre-COVID, annually, we'd serve nearly 400,000 people. We work through a network of hot meal programs, food pantries, and shelters, about 600 across our footprint, and in these 35 counties, as you can see here. Next slide. So the number of people in Wisconsin who are hungry is really 1 in 7. But what we've seen is with people being laid off, people being furloughed, people going out of business, that number has increased by nearly 200,000, going from on average 344,000 people that we feed, closer to 400, to exceeding over 500,000 people. Next slide. What's important to note here is that prior to COVID, there were nearly 41 million Americans facing hunger. And so oftentimes when we talk about hunger and food insecurity, we use them interchangeably, but it's important here to distinguish that hunger is a bodily symptom. And for these slides, we're using the term hunger to describe someone who is food insecure, which happens on a spectrum. And so 40.6 million people were living below the poverty line, which means that they made less than $25,000 a year. So when you look at this snapshot on the dire need of resources, but both government and kind of private nonprofit sector, half of the population were on the verge of either having a sick day or or a sick day or being laid off just moments away from being food insecure. So that's 50% of our population on verge of falling below the poverty line. Before we go to the next slide, I want to also mention that oftentimes when we're doing these presentations about food insecurity, we don't talk about the racial wealth gap and the importance of us knowing about American history and segregation and the opportunities that haven't been provided to all. And so I'll say that people of color are 2 times more likely than a white person to fall below this poverty line for 3 reasons. One is that they didn't have access to accumulate wealth, either through access to capital or real estate to pass down to the next generation. 2, the jobs that they currently have access to, they're more likely to be below this poverty line of $25,000. And 3, they don't have a safety net likely or family members to support them in not falling below the poverty line. Next slide. And so when we talk about food insecurity, this puts people in a really peculiar situation, and that they're now having to make choices between food and utilities, having to choose between transportation to actually still get to work, being on the front line, and food, decisions on paying their medical bills or even housing. And so people were having to choose between these things prior to COVID, but now that these resources are even more scarce, their need for additional resources have continued to increase. Next slide. And so the hunger impact, when our children don't eat, they can't think. And so when you look at that little backpack bullet, that really symbolizes the work that we're doing in education. We have partnerships with Northwestern Mutual and do a number of our mobile pantries with school districts. What our biggest concern is right near amidst COVID is as schools are going back and students are going back to school virtually, they're missing out on their free breakfast and free lunch. And what we know is that many children were counting on that, and that oftentimes some of these students were going home and not eating meals. And so when children don't eat dinner, don't have that bonus meal in the evening, their minds, by the time they go back to school, doesn't process until they get that breakfast worked into them. So like really, they're only getting half their day worth of mental juices flowing. That is not a technical term, by the way. So the second part of this is that it's necessary for children to have proper nutrition and access, a consistent access to healthy and safe food for their own cognitive development. It's important for social and behavioral. Many of us on this line have probably never experienced hunger, but some of us may have experienced what it's like to be hangry. And so it's important for people to have regular and consistent amount of food for your physical ability and also your ability to just have a balanced and healthy lifestyle. Next slide, please. And so really our primary focus, really trying to survive as a food bank during COVID-19, is that we were getting a lot of our food from wholesalers, manufacturers, and distributors. But with the federal programs really leaning heavily on the distributors and the farmers for their federal programs, our priority as a food bank that primarily received food from donors, like surplus food, was to really scale our food distribution and our safety needs. We had to secure additional resources for support for our pantry partners, transportation costs, and the need to move to a push and a delivery model increased, and really looking at the safety of our entire facility. So we went from having like 200 volunteers on any given day to now 2 shifts of 25 volunteers to honor that 6-foot distance where everyone has to wear masks and gloves. Next slide. And so annually, our food bank distributes about 36 million pounds of food. Since COVID, that is slated to increase by more than 24%. And to give you perspective, if you can go to the next slide. Since COVID, from the point of March 1st, when things really started shutting down, to the end of our fiscal year, which is June 30th, we distributed 11 million pounds of food. That's nearly an 85% increase. And during this time slot, the year before, it was nearly 6 million pounds. So because of this, if you can move to the next slide. If you move to the next slide. We've had to really adapt and pivot our ways of being. So we've continued to meet the rising demand of feeding people by participating in 3 different federal programs. One is the Emergency Food Assistance Program in 11 counties in northern Wisconsin. That allows us to distribute government commodities to a set population. That's more the traditional federal programming. The program that came the latter part of last year, which is the TMP, the Trade Mitigation Product, that was as a result of the tariffs to stimulate the farming community. And most recently, we've begun distributing the CFAP, or the COVID Food Assistance Program, which is also known as the Farm to Families Programming. So we went from distributing little to no federal commodities to really getting heavy in the federal commodity programming to diversify the quality, the quantity, and the variety of foods that we're able to distribute to our food network. We've been advocating for state support to help food banks and our partners meet the need. There was recently a $3 million grant, an infrastructure and capacity grant, and also a food product grant that we've written on behalf of our food network to help continue provide the flow of food. Because although you have the federal $600 for the unemployed, and you've had different bonuses and increases in food stamps, that's basically helped to level out the distribution of food resources for a client in need or a household facing hunger. However, we've still seen a dramatic increase in the number of people that we historically haven't seen, such as business owners who have gone under, that pull up in Audis or Lexuses, and you're like, well, they can't possibly be hungry, but indeed their circumstances have quickly changed. And so we've had a lot of adaptations from moving from a pull model of distribution to now a push model of distribution, to having curbside pickups, to contactless pickups, to 100% outside pickups, to new delivery models, and really working with the donor and the foundation communities and even the healthcare organizations to find out how can we do some things a little unconventionally and with a sense of innovation, to really move the needle in helping people who need food to eat. So if you can move to the next slide. I'm seeing all these chat boxes. So that is my presentation. I will pass it over now to Jennifer and Pastor Jenny and Pastor Dan.
Please unmute, Jenny.
Oh, there. Can you hear me now? Can you hear me? Hello?
Yes, we hear you, Jenny.
Okay, good. Thank you for inviting us to speak. I'm going to take the first 5 minutes and let Pastor Dan have 10. And the location of where I'm at is a beautiful green space. 24th and Villard is where Old St. Mike's Hospital was. So that's why we have such a lovely grounds and a lot of space here. We are also, our patient population, it's a family medicine clinic, and our patient population is in one of the zip codes that is considered a food desert. So addressing food insecurity has been something we've done. And now, like Dr. Ahmad said, in the midst of COVID, this has become even more critical for our patients and our surrounding community with the unemployment and isolation and just programs and things shutting down. So we've tried to find creative ways, and starting in March, I think what I'm going to focus on quickly is some of the changes and the things we did to connect primary care to food insecurity, so that when we're training family medicine doctors here for 3 years, they are expected to participate in programs or create programs that we use surrounding shareholders and meetings of people to kind of tell us what the community needs instead of just deciding what they need. So some of the things that we've done since March, when this is kind of heated up as a major problem with COVID, is get the help of medical students to help us create things that actually go into the EMR, so that physicians, when they're seeing patients, are asking questions about food insecurity. They're asking the same questions. And then we have new updated pamphlets that have been generated, also work from staff and Dr. Brian Johnston, one of our faculty, that gives updated resources, because things changed with COVID. Some things shut down, so we didn't want to be giving out and running off things when we talk on the phone with patients that are not updated resources. The doctors also identify families. You saw a slide of me getting ready to deliver imperfect produce, and Ascension has sponsored us to be able to give that to families that are identified, a box every other week. One of the things that changed again because of COVID is I deliver all those, because not only do we want people to stay at home as much as possible, but they can't get out, and many of the people that are food insecure don't have vehicles as well. So we do a lot of delivering. The slides you're seeing going by are things like our doctor there, Dr. Yuka, doing a family dinner at the clinic, which we wouldn't be doing now because of social distancing. And I think you saw a slide of the kids in getting a lesson from my daughter, who's a dietitian and worked with Pastor Dan, and connecting actually the kids that work on the farm to learn why we do this with patients, what kinds of chronic illnesses. That's a picture right there of why they're doing growing vegetables. What does it do for people with high blood pressure or diabetes? So it's kind of like we try to do things in a full circle. We also identify patients every month when the mobile market comes that we sponsor $50 of free groceries. That one of the residents might say, I saw a family, I did the questionnaire, and this family is really hurting. And then not only can we invite them, but if they can't come, I will deliver the food to them. Every contact that I have is a really lovely chance to ask if the family has questions about COVID and what's going on, what their fears are, maybe deliver thermometers along with that, or blood pressure cuffs so they can virtually visit with their doctors. So the contacts might be delivering food and dealing with food insecurity, but they also address that need for answering questions and educating people. Our garden is up and running, but unfortunately the kids didn't get to come and plant it this year. But we will soon. This is the kids in the fall, usually at school, they get to taste the salsa from the tomatoes they've planted, which we have dropped off things at kids' houses so that they can still stay in touch and have videos that we send to their smartphones from their favorite doctor friends and med students. So we're trying to maintain touch with all of this. Another thing that got added was one of the residents' projects was actually getting us some social work hours. And we just started a brand new social worker who will help us about half-time and is an expert. You know, we all try to plug up holes and do things socially for our patients, but the social worker is going to be a much needed addition. We're going to on-site at again at 24th and Villard, there's going to be a pop-up farmers market for the first time in August. And we will be participating with 3 of those at different places around the city. So those are kind of some of the things we're doing to connect primary care. And Pastor Dan is going to tell you a lot more about the wonderful partnership that started 2 years ago with our clinic and himself. So I'm going to actually give up my chair to Pastor Dan. Thank you.
This is my farmer outfit, not my pastor outfit, and I've got to use my cheaters because I'm looking at a 3-inch screen here, so I apologize for that. I'm Dan Chapleska, pastor at Mount Calvary Lutheran Church and School in Milwaukee, Wisconsin. I began my professional career, oddly enough, about over 35 years ago at Mount Calvary as a teacher, and then went to seminary, became a pastor. Ultimately, along the way, got a doctorate in education and served at a Lutheran school for teacher education. So I've had a kind of a diverse background. About 4 years ago, our church was engaged in some strategic planning. And we knew from talking to our neighbors that their concerns were crime, the kids need something to do, and people need jobs. As we surveyed our community, we found that the need for jobs of adults was being fulfilled quite nicely. We had the Joseph Project just 2 blocks from our church, Milwaukee Jobs Works just down the street on Locust, and Community Warehouse doing great work. Fine organizations doing excellent work. And we didn't see a need to kind of nudge in there. So we decided we would work with young people and have them as interns. And we initially got a plot across the street on Burleigh from St. Joseph's Hospital, and a group of volunteers prepared that. We had about 14 60-foot rows and got that ready for planting and dedicated that garden. If you got the next slide there, this was a really great day. The next picture. Yeah, we got a chance to have Mayor Barrett. You can see him there. He's a tall one in the middle. Our Alderman Murphy on the left. Our interns that year, and Edgar Russell, our chairman of our board and member of Mount Calvary. Many of those young, Keith, the far one right, is our lead intern this year. This is his third year with us, so we're excited about that. And then we branched out, and we got a great partnership here with All Saints, and initially cultivated about 0.45 of an acre. We are in our second year of cultivating that. If you got the next slide, you might be able to see that. And we're preparing another, no, I'm sorry, that's a farmer's market. And that's where our produce went the first year. We had a farmer's market at Gangler Park. And then this next slide here, that's one of our interns. This next slide here, Kevin Kleesner on the right there, CEO at St. Joe's, has been a great friend, advocate, partner, champion for what we've done. The chef there on the left, Justin, has done wonders with our vegetables. We've held 2 of our galas that support this work at St. Joseph's Hospital, and Justin did amazing work. It's not your grandma's hospital food, I'll tell you that. It was really great stuff. Kevin has been just a great friend all the way along. Now, what happened this year is we can't get in the hospital to bring the produce. So we've had a partnership with Upstart Kitchen, which is another nonprofit in the Sherman Park community, comes out of Park Lawn Assembly of God. And they help train chefs. Right now they're focusing on people with food insecurity. Actually, we get 25 meals a day, 5 days a week, for mostly parents or people connected with our school who are experiencing food insecurity. And we've delivered over 1,000 of those meals this summer with our community minister through the partnership with Upstart. We just hauled a bunch of produce over to Upstart today. They use it in various ways that they feed people. They do just excellent work with it, and it's been a great partnership. We can't get in the hospital, but we're trying to work stuff out. Kevin did get some makings for salsa today. We got some jalapenos and poblanos and tomatoes and onions for him. He asked for that, so we were able to provide that. What we do is we grow vegetables, but we really see ourselves as growing our interns. Along the way, though, we are doing things to be salt and light in our community. This is a faith-based endeavor and comes, for me, from my theology. And we're endeavoring to really try and make a difference in the community. Next slide, I want to see what that is. I forgot. Got the next slide, or is that the last one? Yeah, that's our farm. Those nettings support tomatoes. People are working there, getting weeds and rocks out of there. Surprisingly, this soil, we had it analyzed, did a soil analysis on it. Surprisingly, it's quite excellent soil. Great nutrient profile, and we've done real well with it. A lot of clay, need to work some organic matter in it, and a lot of rocks that we're pulling all the time. But nonetheless, we've been blessed with a great plot here. Also, because the Milwaukee Health Department is one of 2 labs in the state that will do in their soil profile the lead content. This is surprisingly, astoundingly very low in lead as a soil. So that's kind of the idea here. We would like to see this expand and get better at growing the vegetables, so we grow more vegetables and feed more people. We do want to sell some of this to fund the mission. We'll be a part of various farmers markets, which have been slow in starting. Hope to be a part of that, and that's our story. I'd love to take questions. So are there any questions? Is there another slide, by the way, just in case? I think that's it, isn't it?
That is it. Thank you so much to all 3 plenary speakers. We really appreciate learning from you, and I'm also impressed with your brevity. So thank you for leaving some time for questions. To start with, I wanted to call some attention to what came through in the chat, and also ask out loud one of the questions. I'll direct it initially to Raina, and then Nurse Jenny or Pastor Dan, you're welcome to weigh in as well. So impressed with being able to increase food distribution in this time of so many challenges and decreased resources. And curious how you see this increased mobilization being possible going forward as we move out of the emergency stage of the pandemic and more into the new normal. And I know that you might have addressed that on chat, but if you could speak to that to the group, that would be wonderful.
Sure. I would say, I think those CARES dollars have definitely helped us significantly. As I mentioned in my initial presentation, Feeding America really heavily relied on our donations from wholesalers, manufacturers, retailers. And since COVID, we've really started distributing heavily more of the federal commodities. And so I think in the future, as the generosity and the flow of food begins to dissipate, there is a need for us to, one, continue to work with a lot of these federal programs that provide the variety and the diversity of the foods that we're looking for, but also continue working with our farming community and look at the models that we operate in differently. So we have what's called the Direct Connect program or Fresh Rescue, and that's where we connect our food pantries directly to the retailers for that food that's being donated and that's considered surplus. And so really increasing that program to allow most of our members to directly pick up from those retail pickups. So that time-sensitive food, you get to save some of that time on the client or that member side. And so that's one programming. I think some other innovations is, like I mentioned, moving from a pull model to more of a push distribution model, which helps with the time sensitivity of food. And also looking at doing our combined buying power. And so not only looking at the buying power of our food bank, but also our network of food banks that make up Feeding Wisconsin, which there are 5 other food banks, kind of our sister food banks across the state, and looking at doing joint buys that way.
Thank you, Raina. Pastor Dan or Nurse Jenny, did you want to add anything to that question?
I think there is somewhat of a revolution going on nationwide about this locally grown idea. And there are large tracts of land, even within city limits, that could be put to use and may not be as profitable as you know, the market garden out in the suburbs or more exurbs, but could still do some great work. And if you're a nonprofit and have multiple bottom lines, you can see how that could be a potential for feeding more people with better food. And hopefully that this could very well accelerate it.
Well, that leads very nicely into a more specific question directed at you, Pastor Dan. Wondering whether there are various plots of land identified in the Milwaukee area that can be converted to urban gardens, and what the local government's response has been with relation to funding and other issues.
Well, we were funded, we were blessed to get a very generous grant from the Siebert Lutheran Foundation that got us started. The Bradley Foundation also helped us out in the early going. We did this year get a fresh food access fund from the city of Milwaukee. We met with the mayor as we were, we got a chance, one of our board members had an in, you know, and got us, and he says at least he loves community gardens and he wants to see more community gardens. We really see ourselves as a little bit different model. We're a farm. Community gardens, the idea is that individuals get to have garden plots, and that's great when it works. But a lot of times people have good intentions, and then the summer gets hot, and those raised beds become boxes full of weeds, unfortunately. And it's a matter of, now Alice's garden does a good job of that. They kind of you know, hold people accountable to keep at it. So producing your own food is a great thing. We're farming, we're producing on a larger scale. We're really drawing on the work of Jean-Martin Fortier, who wrote a book called The Market Gardener in 2013 and has kind of launched an empire of exporting those ideas around the world. Small plots of land relatively that provide opportunities for people to make a decent living, providing good food locally grown.
And I wanted to add one thing, in the small scale of what we do at the clinic is our patients get to come in and see their providers and be a part of witnessing the food growing in the back as they do their exercises around the track, and see again the connecting point of why the increased consumption of vegetables and produce could actually affect their health. So it's like we are on a much smaller scale being in the clinic, but we have this right out our back door where we get to be proud and show people what's actually going on and how it connects to their health.
Great.
Yeah, one
And
thing
Raina, I was just going to ask Raina to also weigh in. I can see that she was leaning
Dr.
in.
Dan can finish his thought, and then I was going to pivot just a little bit on another thing that's happening in the food system.
Yeah.
Okay, great.
A lot of the the social determinants of health and issues that affect people of color most severely, but are an issue that comes with poverty. Some of that is something I see as habit, and habit is a matter of education, motivation, and opportunity. Unfortunately, in under-resourced communities and food deserts, there's no opportunity to eat healthy. So we're creating that opportunity. What Nurse Jenny does is she gets, and the clinic does, they work on the education and motivation part. If you lose a few pounds, maybe your blood pressure will be down, and that's good for you. Here's some healthy ways to eat so you can lose some weight. So I see us really creating opportunity that could hopefully become a part of habit for people. Go ahead, Raina, I'm sorry.
To that point, and just segueing, what Dr. Dan is talking about is what we often speak of as food literacy. So it's not only having the accessibility or the access to healthier and safe food, but it's also knowing how to prepare those foods and knowing why to consume them and having them taste them and how to actually budget for it and manage your household to support that healthier lifestyle. But what I was also going to offer to the conversation, just really inspired by what Dr. Dan said, is that in the food system, there's a coming together. I often talked about earlier on that nonprofits in this space prior to COVID often operate in silos, almost with a scarcity model, in my opinion, with a lot of mine versus theirs, and if I don't have it, you don't have it. But it seems like amidst COVID, there are a number of nonprofits and even the foundations and the funders coming together. And I belong to a civic response group, and I want to shout out Danielle Nadek, who's also on this call, who co-leads our civic response food group. And what I'm inspired by is to hear how and to see how our food groups are willing to put our puzzle piece on the table and start strategizing together. And for the first time in our food network, have I really heard people on a consensus basis talk about the root cause of hunger. How are we going to address this from the root, and how can we get the root funded? And so I'm very inspired by that. So to Brian's question on how do we see this in the future, I think as we begin to turn the ship liner around and change our focus from feeding the line to now shortening the line, I think the demand will begin to decrease and the need for our resources will also decrease. It can't happen fast enough for me, but I'm inspired that the conversation is even starting to happen.
Thank you. So I'm going to take us a little bit away from the impact of COVID with the next two questions, but still really important related to this topic. So one question is whether there are efforts to address weather-associated challenges when it comes to gardening in Wisconsin, given our wonderful winters. And then another question is about the availability of soil analysis and if that is a free service that people can utilize.
Whoops, go ahead, Pastor.
Yeah, in terms of, soil analysis, the Milwaukee Health Department does do soil analysis. I think it's $20. It's really not much. $20 for, you know, a couple of samples. It's pretty cheap. It's not free, but it's pretty cheap. And that's always what I would say is the place to start if you're thinking about doing an urban farm, because there's just, especially the lead levels are a concern. And you got to know your nutrient profile. That doesn't mean you can't change soil, because soil's a living thing. But you can, you know, you want to know where you're starting. What was the first question?
The weather associated challenges in Wisconsin.
You know, in the perfect world, we'd have a cistern here and we'd have 40,000 gallons of rainwater collected, so we could get through that. But you can extend seasons here. We've got a season extension hoop house at the garden. We didn't use it well last year, but we're learning.
One of the great things that's happening here in the next month is we are going to have a greenhouse that's quite large. So Pastor Dan will be able to start seedlings. We can, the doctors might be able to work on science projects with the schools down the street, but extending the season with the greenhouse, we'll be able to tell you a lot more about how that works next year. So that's coming soon in the next month behind our clinic.
And Jenny, before you move away, I was hoping that you could also address this question about how the farm impacts health of patients.
We've actually been keeping track for about a year now of blood pressures, and a couple of the doctors, they don't have the data yet, but in the first round after 6 months, we saw reductions in weight and blood pressure specifically. And so as we go forward with the EMR, it makes it really nice when we've selected families that were, the doctors wanted, you know, they agreed to work on these issues and get the box of imperfect foods. And so the first 6 month data looked really good. And come September, I think fall will be like a whole year that the families have been receiving the vegetables. Then we're going to, in the fruits, then we're going to do another round of the data. So I do think that early on we're seeing that people who have access to the boxes and we help them with recipes and ideas for eating it, that it is going to make a difference in their chronic health conditions.
Wonderful, thank you.
Sarah, can I just connect some dots here? It's so, I love these forums for us to share because Jenny, I don't know if you realize is that Upstart Kitchen gets a lot of that produce from Just One More Ministries, who gets that produce from us that provided the 1,000+ meals to the community. And when
amazing.
And when you mention Ascension and with you're working with them, we did a pilot 3 years ago with Ebenezer called the Under 8 program. I don't know if you've heard of that, but it's where we provided boxes of fresh produce and recipes. And for 16 weeks, the patients, it's almost like food prescriptions, the clients would have to get the box of food, and to incentivize it, we would check their vital signs, and we were checking for their A1C levels under 8. Mm-hmm. And so just like you, we check the blood pressure, we check the weight, and after 16 weeks, it sounds very similar. And so I think there are a lot of opportunities for us to connect after this now.
Oh, that sounds wonderful.
It's always really great to hear all the connecting points. And I appreciate you making that connection, Raina and Nurse Jenny. I know that we're about out of time for questions, but I did want to close with asking all three of you, if very briefly, think 30 seconds at most for each of you, if you could just kind of high level talk about what have you learned having to adapt to COVID, just as we move into our small discussion groups. It would be helpful to hear from each of you some of your learning points or observations.
Okay, I'll be glad to start. It's been inspiring since March when we kind of fell into the COVID hole of seeing the medical students and the faculty that I'm privileged to work with, and all of in meeting Raina and working with Pastor Dan, but the creativity of how to make things still work has been the inspiration. And just what I love to do the most, because I'm on a much smaller level than what Raina's doing or Pastor Dan, is just getting in our cars and taking stuff to people without asking questions, and having the doctors and the medical students say, well, let's just get on the phone, and if you take a blood pressure cuff, and just having to really mold to the situation has been the inspiration, because then I think whatever is thrown in our way, we're not going to let that stand in the way of still meeting the needs and addressing these things that the community is crying for. So that's been the inspiration to me, is we've had to be flexible and creative, and that's what I love the most, is having everybody on the team feel the same way.
Great. I'm going to ask Raina if she can speak next.
In this time, and as you can see, I'm not in a traditional office. I'm working from home with my little 3-year-old. I am awe-inspired. What I did mention about our food network is that 90% of them are faith-based organizations. So really pastors and volunteers in the basement soup kitchen, right? And so what I'm inspired by is that never before have I been able to bring my faith to work and to be surrounded by people who are faith-filled. So that's one piece, but the innovation and the necessity to pivot in this time is really showing the resilience of our network. And as Danielle mentioned in her comment here in the feed, is that I'm inspired about where we're going, and it's so much brighter than where we've been, and that there's been actually a public acknowledgement that we have a problem, and that hunger is a problem, and I don't think it's going away, because now we have the attention of elected officials and funders that I don't think will let this go and are committed to doing something about it through a policy lens.
Final thoughts, Pastor Dan?
Yeah, I think what comes to mind most is God is faithful. And, you know, in this storm, God has been faithful. I will tell you, I'm getting tired of it. On an emotional level, on a mental health level, I can see where this can get really, really to people after a while. I do think that in terms of churches, which maybe translated to the larger nonprofit community, those churches that were inwardly focused before this only became more so. Those churches that had a proclivity to be outwardly focused found no end of opportunities. We partnered with St. Joe's, and for a period of about 6 weeks, we made 40 lunches a day, no, 60 lunches a day for the housekeeping staff at St. Joe's. And we made a total of about 1,600 lunches we provided for them. It was pretty simple fare, but it was a way to support them, kind of the least of these, of the heroes. You know, as that kind of ran its course, we agreed with St. Joe's to sort of stop. But there, you know, those there's a verse in Ephesians that says, "For we are God's workmanship, created in Christ Jesus for good works, which He has prepared beforehand for us to do." So I don't have to really beat my brains out trying to find stuff to do in the community that's going to make a difference. It finds me. It always finds me. There's lots of opportunities there, and you know, it's just trying to discern what are the good works God has prepared beforehand for us to do. Where is it that we can move into? The farm thing, you know, there were so many things that were just providential, that were the hand of God guiding us to this place. So, you know, God is still faithful. That's the biggest thing I would say coming out of this.
All right. Well, thank you all for your final thoughts. And again, we appreciate you sharing how you have really been working tirelessly during this time to impact food insecurity.
So we're going to have an ending to this by pulling it all together. And I want to ask each of the discussion groups to speak into what they talked about. So could I have a representative just to give, you know, about a minute or so to summarize what you talked about in your groups?
I can start out if you like, David.
Thank you, Dr. Johnston.
Thanks. So we were from the clinical setting group, and we talked a lot about the challenges of identifying and addressing food insecurity with patients in the clinical setting, both in related to time management, trust management. So how to, it's really a sensitive and kind of personal conversation with patients, and how to build and leverage trust towards those conversations. And then when intervening and connecting to some of these resources that we've heard about today and others in the community or other ways, how to do it in a way that's conscious and has sort of like a continual feedback loop, so that we're not just sending patients out the door with a handout of sheets of paper and, you know, good luck, but some sort of way to know that they're cared for in this way. And finally, we want to, going forward, I think, cement some of these connections and relationships to community organizations, and really bringing back what Pastor Dan said in the beginning about the inward versus outward focus. So in our future careers, we want to be outward focused and community focused in our approach.
Thank you, Dr. Johnston. Can I call on Ms. Greer and Dr. Simmons to give a summary from your group, please?
Yes, we had a nice group, and one of the things that we really discussed is that it's not just about giving out food, although we do have to support the agency as a business, that there is so much more being given out, not only food, but also communication and information about what's going on, being that connector piece, and then also thinking about non-traditional, not only funding sources, but also non-traditional communication modes, using text messaging, using different types of way to meet the people where they're at, and then also looking at possibly using your skills to look at innovative ways to make a difference in the amount of advocacy and sharing the voice of the individual, say surveying and that type of thing, but being that connector piece. Chris, did you want to add?
Unmute, please.
There we go. Hi, everybody. I think Yvonne did a great job of summarizing it there. I was in the middle of trying to make a systems argument, as I so often do, and I think I get kicked out to the main group, but just making sure that we understand that there are systems of oppression that really permeate not only the city, the state, and other, but they continue to be in place, and COVID only exacerbates those conditions. So making certain we're thinking about sustainable systems changes that are focused on equity and social justice.
I got the 2-minute column, and so I'm going to say for our group that a big question that we discussed and the big comment that we discussed in our group was meeting folks where they're at, and we had many examples of that. Mariah, do you want to add anything else at this time? I'm going to move on to Pastor Dan and Dr. Ahmed. Would somebody give a summary for about 30 seconds from your group, please?
I was muted. Sorry.
Thank you, Pastor Dan.
I think Zoom has made us all better lip readers. I think that food is important for our bodies, but food in community feeds our souls. And there was a lot of emphasis on community and how that impacts, whether that's gardening or how communities come together or how communities eat together.
Dan.
Sorry, I was mute too, but quick point. I said that everybody's invited to visit Pastor Dan's farm. That's
Thank
what
you.
one of the message was.
Yeah.
Thank you.
Ms.
Go
Denome,
to
can
the
you?
statue of St. Francis and keep going. You okay?
Thank you. Ms. Denome, can you give a summary from your group, please?
Oh, hi, everybody. We did not have high enough enrollment in the policy conversation. So I actually had the pleasure of being in Pastor Dan and Dr. Ahmed's group, which I really enjoyed. So
Thank you. And if anybody has questions around policy and food, Melissa Denome has some expertise in this area. I want to thank everybody for joining us. We talked about hope in our session, and we talked about the things that this is an epidemic that's not necessarily going away. But we do think that when we continue to connect and continue to deepen those connections, not only through the expertise that we have, but through our faith, through our social relationships, through our psychological relationships, through our biological relationships, because food is health, that we can do better for all people. This is such a joy to take this opportunity to go from COVID, which has been an epidemic, which has killed hundreds of thousands of Americans, to action where people are actually continuing to do things. I hope you'll join us again in the future. We plan to have another COVID to action. We will be sending out a survey on how you thought the session went. And if you have any questions or comments, you can get a hold of Sarah O'Connor, Kelsey Heindel, Dr. Ahmed, or myself, and we will be glad to support you through efforts at the community engagement at the medical college. On behalf of all of our team, we want to thank you. Continued good health and blessings to you and to yours.